might make today. Some of you have probably heard about the new cancer facility that's going here in Redmond, and we have Ryan Lamb, who is the construction program manager, and Maury Shea, who is the administrative and chief nursing officer for the cancer and ambulatory care services, and probably you're wearing some other hats. And then Angela, you are the community relations director for St. Charles?
Community partnerships officer.
Okay.
Yeah.
That's a mouthful.
It is.
So why don't you all come up here? You're going to have plenty of time to share a great resource that we are getting here in Redmond, and we will give you the floor. Okay, welcome. Thank you.
All right. Hey, thank you so much for having us. We're excited to share with you today about the new cancer center that we're going to be building in Redmond here, really breaking ground in the spring. So Mari's going to go ahead and lead off and share with you just some of the services and really the why behind what we're doing. And then I'm going to show where we're at in the process and what you might expect to see popping up out of the ground here pretty soon. So, Mari, yeah. Yeah.
Okay, so for many of you may be aware that this project started way back in probably 2018, 2019 when we secured bond funds and had an approved project to move forward. And I don't know if anyone remembers what happened shortly after 2019, but things got put on hold. So we're very fortunate that we've been able to bring this project back starting last fall and are super excited to move forward with this very large expansion of our existing services. So just to give you a little bit of the history behind this, for those of you who aren't aware, the St. Charles Cancer Center is located mostly in Bend. However, we already have a current Redmond campus, or Redmond Center. It's very, very small, but we do have one. We are nationally recognized for our evidence-based care. We have been continuously accredited since 1987 with the Commission on Cancer, which is the national accrediting body for cancer programs. So we compete with NCI designated, which are the highest level cancer centers. So those are UCLA, some of the top universities and cancer programs in the world. Again, in 2018, we were given an Outstanding Achievement Award, making us one of the top 5 cancer centers in the top 5% in the nation. And then we just had our dual accreditation. So we're actually accredited for our entire cancer program, and then we also have an additional accreditation through what's called NAPBC, which is focused primarily on the breast cancer program and the services that we provide. We are lucky we get accredited back-to-back every 3 years. Those two surveys always run up against each other, and it's a lot of work, but both of those recently we were recognized again as best practice. So we do have a fully what we call comprehensive cancer center, meaning that we provide all services that cancer patients need under one roof, which is really important for anybody who's going on that cancer journey. And again, in Redmond, we are limited. We have medical oncology, and we have a smaller infusion room. And so as we go through the services that we're bringing as a result of this cancer center in Redmond, I think you're going to be pleasantly surprised at just how much is really coming and how impactful it's going to be. Just to give you some background, for Central Oregon, we are the sole provider of radiation services. So we have a very large catchment area. We are the sole provider of thoracic surgery, GYN surgery, and we provide about 70% of all medical oncology services for all of Central Oregon. So we have a large patient population that we need to serve. So the two little pictures right there, the one with the blue bars is if we pull all the facilities within that are accredited through the Commission on Cancer throughout the United States, the light blue bar is the distance our patients are traveling compared to everybody else. So you can see that in some of those, and it's by miles. So the middle bars where it's really high, those are patients traveling 10 to 24 miles. And then if you go all the way over to the second one from the end, those are patients traveling over 100 miles to get care. That is 100 miles a day that they're traveling. Because if anyone's familiar with radiation, that is a daily experience. And so our patients are traveling greater distance to receive care than most other facilities across the nation. So that's very impactful. The other one is actually a slide from 2017, but when we brought this project back up, we looked at it again. This shows where our new patients are coming from. So we track everything in the Cancer Center through data, and we know exactly where all of our new consults are coming from. The kind of the blue is outlining the Bend, our current catchment area, but then we wanted to say, what would happen if we put a facility in Redmond? So that red one shows all of the patients that currently live or have currently been referred to us in Redmond and our northern communities. And so you can see it's a large volume of patients. We say about a 40% of our current patients live in these areas. It is higher for radiation. About 50% of our patients live in Redmond or north. So it's a significant impact for them to be traveling distances. So.
All right, so that's kind of some of the why. This is going to be a little bit of the what. Can you all see this? You in the back? Okay. So this is just a Google snapshot of just a satellite view of the main hospital campus. I don't know if I can move my mouse over here or not. Yeah. So this is the main hospital emergency department area, helipad here if you're familiar with it. This is Highway 97. This is our existing tower. We like to call things towers even if they're only 3 or 4 stories. And then just south in the empty lots here, south of Kingwood Avenue, is where we're going to be putting this new building. So we currently own 4 of these lots. We're going to be converting 3 of them, combining them, and dropping the building on this area. So Canal Boulevard and Kingwood, and I'll go to the next to show what that is going to look like on site. If I can find my mouse. Where'd it go? It's on this one. There it is. Okay. Let's see here. Yeah. Site. So this is a artist's rendering, a conceptual rendering of what the building's going to look like from the front end when you come in off of Kingwood. So I'll show you that in a minute, the site plan, but we'll come in, and then really this is the entrance of the building right here. Again, this is a conceptual rendering, so a lot of these details will probably look different. I doubt this car will be parked here when we open. But we'll have a covered canopy for drop-off to meet FGIs, and we'll have heated sidewalks across all the ADA spots here. I'll show you that in a second on the overall plan. This will just give you kind of a sense of the type of building that we're looking to build and the progress that we have currently. This is a different view from a little bit of a different angle. Again, entry kind of over here. This will be the covered drop-off area. On the second story here, you can see it a lot better on this one, is the infusion center. So I don't know, are any of you familiar with the facility in Bend? Have you seen the facility in Bend? So one of the real big, patient satisfiers and just advantages of the Bend facility is that the infusion center is up above on that second level. So as patients are sitting there for hours on end receiving their infusion treatments, they're not staring at a parking lot with cars. They're getting views of the Cascades and getting a little bit more of that therapeutic view while they're sitting there. So that's what we wanted to provide with this building, was not just putting the infusion center on the first floor where they're staring at some landscaping or something, but to kind of get it up and elevated. So this is actually looking west, and so you'll have a view, and the infusion patients will have a view of the Cascades, and just a really cool thing that we were excited to be able to offer with the building. This is the site plan. I mentioned a couple of times, just a little bit more detail. So again, this is facing west out here. This is the infusion area. Kingwood Avenue is where the main entry will be. And then we believe we're going to get a second entry off of Canal. We're kind of working through that with the city as we go through land use. Parking here, we'll have a couple RV spots. Some of the patients, as Murray mentioned, come from long distances, and need a place to stay. So we're hoping to provide that with some RV spots and then EV chargers. So that's become a real big thing here. Just across the board over the last several years, needing to offer that as a facility. So we're going to have some RV charging stations. So if any of you have a Tesla or a Prius, I think those are now electric, you can plug it in there. Okay, so we're getting into the floor plans here. Just wanted to give you a high-level overview of what we're looking at. This is the first floor. We kind of separated the building. So first and second floor is kind of a stacked clinic model. Essentially, the bathrooms are stacked first to second, so they can share plumbing in the walls and just gain efficiency that way. So this is really the exam room, exam area core. We got integrative therapy, surgical oncology, high risk. Mario will speak to some of that in a second here. Radiation oncology with all the exam rooms, soil, clean hold, and then office areas kind of around the exterior. And then on this half of the building, separated by the lobby and the main entry here, we've got the Linac vaults. We're going to open the building with one vault functioning, and then we'll have a second vault that we'll be able to put equipment in. We're not going to be putting equipment in right away, but we have the capacity to do that in the future as patient volumes increases, because it's really expensive to build a vault with 9-foot concrete lid and 6-foot concrete walls, 6 foot thick. So they're very expensive to build and really challenging to build if you're trying to keep one of them open. So we thought we were going to build both of them out right now and provide that future capacity. And then the rest of the downstairs here, this is kind of supporting services, radiation therapy, education, conference spaces, just some staff spaces that we need to provide the services. And then you'll move up to the second floor here again. Sort of the lobby is separating the building halves as we're thinking about it. We're going to have skylights in the roof that will translate some of that light down through, even down through to the first floor. This will be kind of an open stairway and then an opening here above the registration desk. So we're really trying to bring in just some daylight and provide a little bit more of a healing environment for patients as they're waiting. And then up here really is medical oncology with the 19 exam rooms. Infusion here down on the lower right-hand side. Mario, remind me how many infusion chairs. Is it 20 chairs and then 3 bays, something like that is where we landed? I think.
24 total.
Yeah. 24, so we have 20, I think it's 20 infusion chairs, 3 bays, and then a bedroom. So 24 total. And then we have our pharmacy area here that we're going to need to meet USP 797 and 800 to do all of the drug prep for the patients. Before we move on, are there any questions about the building here? Yeah.
About the infusion treatment, do you supply any kind of psychological help to the patients? I know kidney patients have that option.
Yeah, so we currently have licensed clinical social workers on site. And then we have our partnership with our behavioral health team as well as our palliative care team that can provide that additional behavioral health support. And then one of our strategic initiatives for this year is to really build out a formalized behavioral health cancer program kind of partnership, so our patients have that direct referral and easy access to those services. So yes. Yeah.
And then I didn't get into timeline. I don't think we have that on this. Let's see. So yeah, so timeline for the building. This thing has been in one phase of planning or another since 2017. It's been a long time coming. We've been in intensive design since this time last year is when we onboarded our architect, working through just different floor plans and services that are going to be in the building. So now we're actually in 50% DD, which is design development. The design phase moves from schematic design to design development to construction document. So we're getting pretty close to having our construction documents ready. We're planning to submit to the city and then hopefully break ground in the spring with maybe a couple packages that we would submit. So a site package to get the site going, and then a building package to follow where we'll have all the other details worked out so the city's not bombarded with all of that stuff. And then the goal for this is to go live in Q3 or Q4 of 2025. So it's going to be a couple more years here before the building gets built. So Mari, I think this one's yours.
All right. So I'll just kind of run through some of the services that are coming to Redmond or are changing. It's pretty significant. So we do chemotherapy, but to give you a reference, we have 14 chairs in Redmond. We're moving to 24. So we're almost doubling the capacity. The other thing to know about us is that we are not limited to just infusions for cancer patients. We actually do all of the rheumatology infusions. We do any infusion that really needs to be done, especially in Redmond, because there are no other sources. So a good portion, about 30% of our patient volume every day is a non-cancer patient. So it's our women's health, our neurologists. It seems like every new drug coming out on the market is either a long-acting injection or an infusion. And so this will really be able to expand that service out to make sure that patients who need infusions in Redmond can stay in Redmond. Radiation oncology, this is the big one. There are no radiation services in Redmond or anywhere else besides Bend, and so it's really impactful. And if you think, well, Bend's not that far, but if you're doing that commute every single day going through treatment and you don't feel well and you're tired and you're asking your family and your friends to drive and then throw winter on top of it, we actually will have patients who will actually forego treatment because it's just too challenging. Then, of course, we have our patients that are more vulnerable. So we serve everybody at St. Charles, and so we have a fair amount of patients that often are homeless or have in some transitional living unit where they really do need our assistance to be able to get to treatment. So with that, Brian talked about the what we call the Linax. That's the machine that delivers radiation, but we are bringing a brand new service to Redmond. We are going to launch it in Bend because the equipment is due to arrive in about a month. And that is a program called HDR, or high dose rate brachytherapy. Nobody offers it in this area. There's probably maybe 3 in the entire state of Oregon. There are very few radiation oncologists that specialize in it currently. We've lost a few over the last year. This is a very specialized treatment for many cancers, but specifically it's widely used for our gynecologic cancer. So this is something else that we can serve the women living in this area. We have the only oncology surgeon in, again, there's less than 5 in the entire state. So she happens to call Bend her home and lives here, so we're very fortunate. But when her patients need treatment, she has to send them somewhere else. And oftentimes we're having to send them out of state because it's not a service that's offered. This is a once-a-week treatment because it's very high dose. So we want to be able to offer this to all the women living in this area and really throughout the state, because this will allow us to become a destination site for this treatment. So we're going to launch the program in Bend to get started, and then as soon as this opens, we will be moving it into this, and we're building a really nice little suite to perform this therapy. So that's really exciting. Surgical oncologists. So we have our own surgeons within the cancer program. That is, again, our GYN surgery. We have the only fellowship-trained breast surgeon in all of Central Oregon. She has been with us a year, so we are building a surgery clinic within this that we currently don't offer those services, again, in Redmond. So, again, we're going to have that specialty clinic, and we are actively recruiting for a reconstructive surgeon that will focus specifically just on cancer patients. So less on the plastics and more on helping patients recover from the surgery. So those are big. Integrative Therapies is a fantastic program that we've had for years. I think it's what sets us apart from a lot of other programs. Best part is it's completely funded through our philanthropy. So that includes programs like Reiki, massage therapy, acupuncture, those kind of programs. So we do offer it in very limited out here. It's just if there's an exam room, they'll come out and do a few massages a week. But this will actually give them a full clinic space to bring all of those services. And those are super helpful as patients are going through treatment to help manage symptoms and then throughout recovery. So lymphedema therapy is almost everybody has to go through that at some point, especially for our breast cancer patients. We'll have lymphedema therapy space, and then we'll be bringing pelvic floor therapy. So, and that's male and female who are struggling with that after they've had surgery. So we will be bringing our high-risk breast clinic and genetic counseling. So we're very fortunate to have the only genetic counselor in Central Oregon seeing patients. And actually, it's not just our high-risk breast clinic that we already have. We're launching a full new expansion. We started earlier this year, for those of you who attended the Sept Gala. Thank you. It is a very large, wide-scale, what we call a high-risk and genetics program, where we are going to be launching and reaching out to anybody living in Central Oregon and beyond, the ability to take free risk assessments to find out, are you at risk for a hereditary cancer? 10% of all of us carry a gene that could end up giving us cancer at some point. Identifying them and then helping manage and connecting them to our resources. And part of this program is that this will have a large virtual component. So our patients living in Warm Springs don't have to drive to Bend or even to Redmond to receive those services. We can do a lot of it virtually. So this program's clinic will be housed out of the new Redmond facility. And then again, some of the things you'd asked about, expanding our supportive services. So we have licensed social workers, we have nurse navigators, we have dietitians, we are running support groups. This space, this new building gives us the ability to really design a space where we can continue to hold those programs and invite anybody into the community, whether you got treatment from us or not, to come in and share and meet other patients and benefit from our services. So that's going to be really impactful because there's no support groups right now in this area. So happy to answer any questions. I know I would, yes. I would do that quickly.
2 questions.
Yep.
Obviously, in Bend, the only adult housing
Yes.
is at the Ronald McDonald House. Is
Yeah.
there any plans in Redmond to have any type of housing for those families that have to travel, or the patients have to travel
Yeah.
significantly?
Good question. So we've had a lot of conversations. We've had a lot of conversations with city leaders, especially when we first launched this project about, we've had a lot of city leaders coming and saying, what can we do to support this? And that's the number one thing we're saying is we need housing for our patients, as well as the number of staff that we're about to recruit to fill this, right? And so we've had a lot of conversations. We did thoughtfully put in the RV lots because those are very popular, but no, we know we need additional housing or lodging options for these patients, yeah.
And then second question, any plans either in Bend or Redmond for pediatric oncology coming?
Not currently. In order to do that, our medical oncologists are not trained in pediatrics. That's a separate fellowship and specialty. The pediatric services at the hospital would have to bring up their level a little bit. It is a gap in the community, but it's a gap for all pediatric infusions. So we're trying to work on some kind of contingency plans for maybe being able to offer some, but it would be quite a big lift for the pediatric community. Yeah. So we would have to have a peds ICU.
Right.
Yeah.
So Lauren, what does that mean? Kids have to go to Dornbecker or?
Yeah.
Yeah. The only 2 places that treat pediatric are
Yeah.
Randall and Dornbecker.
Yeah.
Which is why our 2 bigger houses are up there, because
Yeah.
they serve everybody in the state dealing with pediatric oncology.
Yeah. It's a challenge.
What
yeah.
about, take off on that. You mentioned you have kind of casually, you have some folks that are unhoused, that are patients.
Mm-hmm.
Do you connect them with a social worker or somebody that can help them? Because
Yeah.
they certainly shouldn't be going back out into the junipers after something like that occurs, or even
Yeah.
to a overnight
Yeah.
center of some sort.
Yeah. Yes. So we have a social work team in the Cancer Center of 2. And I would say they spend the majority of their time doing this, but they are well connected with all of the resources. So if the patient has no temporary housing, sometimes we're able to. We have used our 1 adult unit I think we book it full time, where we will put a patient up there the entire length of their stay or their treatment with us. We've been able to get them into like Bethlehem, and some of the other housing facilities will allow them, and they'll actually transport them. That's really common here. They'll transport them back and forth. And then occasionally we have some that will return to that shelter environment or back out to their camp or wherever they live. And so we will provide transportation for them. We pay for all of that through our philanthropy.
Well, some of
But
that,
it's
some of
very
that,
challenging. Yeah.
Oregon Health Plan, Medicaid, we pay for.
Yeah, so that's, anyone coming in, if they're uninsured, the first thing we do is get them connected to any insurance that we can, whether or not it's through Oregon State,
Right.
Oregon Health Plan, or even through our programs that we have at St. Charles. So, yes, yeah. Yes.
What integrative therapies are offered in Redmond right now for cancer patients?
Primarily massage therapy. Yeah, so we have a massage therapist who spends 1 or 2 like half days in Redmond all the time, and then she's actually floated over to Bend for a while when we needed some help, but she's primarily here in Redmond. We're limited by space, as most healthcare facilities are. If anyone knows where the Redmond Cancer Center, I call it the strip mall, because it's like a little strip mall of little clinics, and so it's just, you know, very narrow, one little. Just to give you some context, there's only 7 exam rooms in Redmond today. This new facility, just in medical oncology, will have 19. So it's actually, the Redmond facility will actually be bigger and be able to serve more patients than the Bend facility, because we're out of space in Bend. So, so we're building it for our current, but we're also building it for the future to make sure that we can continue to serve our community and have the space to do it. So, yeah. Ryan asked me yesterday how many patients this building will serve. This building could easily serve 350 to 400 patients a day, which is a little bit more than Bend. Between the 2 facilities, we're around 300, 315 a day. So currently we service at a max, about 100 a day in Redmond. So it's a pretty significant lift. Yes?
That seems big for a community this size, isn't it?
Yeah, we have a very large catchment area, yes. Yeah, and there's been challenges. I mean, healthcare is challenged everywhere, but throughout the state, the Dalles they haven't been able to offer medical oncology or any chemotherapy for about 8 months because they lost all their providers, their physicians, and they couldn't recruit. So they had to make a very strategic move, and they had to partner with Adventist because they were at risk of losing their entire cancer program. So those patients came to us. They didn't want to go to Portland, so they came to us. Klamath Falls, they were without a radiation oncologist for over a year. So those patients need treatment, so they all come to us. And then, of course, we have all the rural communities in a network. So we treat patients from burns. We've trained the nurses in burns to administer chemotherapy. Our physicians travel to burns. So we do a lot of that outreach, but there's just limited services available, and other cancer centers are struggling to recruit physicians. And so, fortunately, living in Bend and Redmond, it makes it a little bit easier at least, to recruit physicians, because this is somewhere that people want to live. So we're very fortunate. Yes?
I don't really have a question, but a comment that I was born and raised in Madras. And when my mom went through cancer treatment, like you mentioned, driving back and forth for radiation every single day was hugely taxing on her.
Yep.
And so, thank you.
Oh, you're welcome. Yeah. Thank you. Any other questions I can answer? Yes.
So, off track a little bit, but it's related to the other questions. Does Central Oregon have a higher cancer rate per capita than other places in the country?
Good question.
Not necessarily. There are certain cancers that are more prone to this community than other parts of the state, I would say.
Like skin cancer?
Lung cancer? Yeah.
Dust or smoke?
Smoke. And smoking. Like Oregon has a really high smoking rate still compared to other states. I think that anytime you're in a rural community or rural area, you're going to see higher rates of cancer, and that is oftentimes just due to limited access to services. So I think it's a pretty complex question, but I think that what we see is consistent with probably because, even though Bend is Bend, it's still considered rural. And so I think we're consistent with some of the others. What is challenging, though, is I think the disparity that we have. We have the very top, well-insured, and then we have all the way down to the patients that are, very, very homeless, completely off the grid. So we have a really big gap there, I think. And so it's a difficult population to serve, whereas when you're in like more of an urban setting, you tend to have kind of the same patient population. So if that makes sense. Yeah.
Thank you all.
Thank you.
We have a couple of party gifts for you. Ron, will you do a picture
I will.
for us?
Oh.
Sorry, we have to do a picture. So these are some hand-turned juniper pens, and I'll give you two.
Yes, I'll
Leave. So just give a quick picture here. Thank you.
Yeah. Maybe take
Okay.
I got it. You
This
got
is
it
your
right?
last lunch
Yeah.
picture.
It's the last lunch picture.
Is this your last lunch picture?
Last one. Turn over present. All right, thank you so much.
Thank you. Yeah.
All right, thank you all. Again, if you did not get an email from John about RSVPing for next Wednesday, please email him directly if you want to attend. Food pickup this Saturday, 10 to 12. Please help Earl out. And then have a great week.